Assalamu alaikum wa rahmatullahi wa barakatuh, ladies and gentlemen. My name is Dr. Mohamed Harrary. I'm a consultant cardiologist with interest in heart failure. I'm currently holding the position of the chair of the heart failure group of the American Heart Society. Today I'll be talking to you about iron deficiency in heart failure. Iron deficiency is common in patients with heart failure. Studies have consistently shown that it is independently associated with impaired health-related quality of life, exercise capacity, morbidity, and mortality, irrespective of the presence of anemia. As such, international guidelines recommend that all patients with heart failure be periodically screened for anemia and iron deficiency with a full blood count, serum ferritin concentration, and transferrin saturation. A number of heart failure trials, including the FAIR heart failure, confirmed heart failure, effect heart failure, have shown that treating patients with intravenous iron is associated with improvement in symptomatic well-being, including exercise capacity and health-related quality of life. Although these trials were underpowered to detect reduction in heart clinical endpoint, two recent meta-analyses have shown that intravenous iron is associated with reduction in heart failure hospitalization and cardiovascular death. On the other hand, several studies, like the Iron Out Heart Failure trial, have shown no such improvement with oral iron supplementation. This is attributed to the poor absorption of oral iron and the inhibition of the release of iron from body stores seen in heart failure patients. Therefore, oral iron is not adequate to treat iron deficiency in patients with heart failure. The recent heart failure guidelines address the issue of iron deficiency in heart failure. The 2022 ACC AHA HFSA guidelines recommendation are that in patients with HFrEF and iron deficiency with or without anemia, intravenous iron replacement is reasonable to improve functional states and quality of life. The European Society of Cardiology guidelines for 2021 recommends that patients with intravenous iron should be considered in symptomatic patients with ejection fraction less than 45% and iron deficiency to reduce the risk of heart failure hospitalization. And based on the results of the AFFIRM acute heart failure trial, the European Society of Cardiology guidelines for 2021 has also recommended that intravenous iron should be considered in symptomatic patients recently hospitalized for heart failure with ejection fraction less than 50% and iron deficiency to reduce the risk of heart failure hospitalization. Furthermore, the recently published Ironman study gave us further reassurance about the long-term safety of intravenous iron and provided additional evidence that correcting iron deficiency by administering high-dose intravenous iron improves well-being and prognosis for a broad range of heart failure patients. Thank you.